going to have you stand up first.
Yep.
Raise your right hand. Do you swear or affirm under penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth?
I do.
Have a seat. And if you could pull up to the microphone.
Yep.
And also, if you feel comfortable doing so, if you could remove your mask so that we can hear you better.
Okay.
And I'll leave mine on. And if we could begin by having you give your full name, spelling each of your names.
Seth Zachary Bravinder. First name is S-E-T-H. Middle name is Z-A-C-H-A-R-Y. Last name B-R-A-V-I-N-D-E-R.
Zeldridge.
Thank you, Your Honor. Good morning, Mr. Bravinder. Am I saying that correctly?
Your Honor.
Bravinder like lavender.
That's right.
I'll try to remember that. Thank you. Where do you work, sir?
I'm a paramedic with Hennepin EMS.
How long have you been a paramedic with Hennepin County EMS?
I started in June of 2017.
And is your title paramedic?
Yes.
Okay. And has that been the case since you started? For that past 3 to 4 year period, you've been a paramedic by title?
Yeah.
And what's the training that goes into becoming a paramedic?
Prior to becoming a paramedic, you have to be an EMT already, which is a fairly short course, and then paramedic school was about 12 months long. So,
just to back you up, you said you have to be an EMT first. First, what's an EMT?
It's a lower level certification, a lot more limited in your scope and skills and what you can do. To give an example, my EMT course was like a 6-credit college course, what it was.
So you became an EMT in college?
No, I actually attended a course when I was a senior in high school.
Okay.
And
so maybe let's start there, just in terms of what your training was, first in becoming an EMT, and then what you went through for that.
I attended an EMT course at Ridgewater, my senior year of high school, Ridgewater College in Hutchinson, and I started on a volunteer ambulance out where I grew up. And
was that while you were still in high school?
Yeah, kind of. Pretty much as I was graduating, I started that.
So you said that there's an additional training path, an additional certification that's required to become a paramedic. Is that right?
Yes.
So did you do that immediately afterward, or was there some time in between?
A little time in between. I started my paramedic course, would have been 2012 in May with HCMC, and then graduated in May of 2013.
So you went through training to become a paramedic at HCMC from 2012 to 2013, is that what you said?
Yes.
And what does that training entail to become a paramedic?
There's a lot of book work and a lot of hands-on skills training, clinical ride-alongs on ambulance and different clinicals throughout the hospital.
Is that a year-long training?
Yeah, the whole course was a year.
And did you complete that successfully?
Yes.
Is there additional testing or certification requirements you have to go through to become a paramedic?
Yes.
Can you just describe that a little bit, please?
There's a written exam that we have to take to get our certification, and also a skills exam.
And did you complete that in 2013?
Yes.
And what about to maintain your license or status as a paramedic? Is there continuing credit or education you have to go through?
Yeah, we have to recertify every 2 years.
And are you up to date on all that certification?
I am.
So let's talk about your job sort of on a day-to-day basis. What do you do as a paramedic at Hennepin EMS?
I work with my partner on an ambulance. We respond to 911 calls, primarily medical emergencies, and provide care to our patients and transport them to the hospital.
What kinds of calls do you get? You said medical calls. Can those vary?
Yeah, and anything somebody would call 911 for.
Have some of those calls been life-threatening type emergencies?
Yes.
Have some of those calls been cardiac in nature?
Yes.
Drug overdoses, things like that?
Yes.
Other types of things? What else did you respond to?
I guess mental health problems is included in that as well.
Okay. And what is your primary objective? What is your job when you go out to a scene as a paramedic?
To provide the best care I can for my patient and bring them safely to the hospital, the appropriate hospital they need to go to, and also advocate for them when I need to.
And when you say advocate, what do you mean by that?
Just making sure that their complaint or their problem is heard and communicated effectively to the receiving hospital as to why they're in the emergency room.
So when you're talking about advocating, is part of your process as a paramedic to hear and understand what the patient needs and is going through and pass on that information to the hospital?
Correct.
I'm going to direct your attention to May 25th, Memorial Day of last year. Were you on duty as a paramedic with Hennepin EMS on that date?
I was.
And was there a call that you responded to that evening in the area of 38th and Chicago?
Yes.
What was the nature of that call? How did you become aware of it?
We were dispatched. We have our screen where we get our calls on. We were dispatched, and our notes said we were going code 2 for someone with a mouth injury, and PD was on scene.
And when you say code 2, what does code 2 mean?
Routine, so no lights or sirens, normal driving.
So you said routine and no lights or sirens. Does that what does that indicate to you in terms of the criticality or how serious that call might be?
It'd be pretty low criticality.
Okay,
Yeah.
so-
No life-threatening indication if we're going code 2.
Okay. Where were you coming from when you heard about this code 2?
We were downtown at HCMC when we got it.
And did you get into your ambulance at that time, assuming you were responding to a code 2 call?
Yeah, I believe we were already in it, but
Okay.
yes.
Did the nature of that call or did the code level of that call change at some point?
It did about a minute and a half after we got it, I believe.
And what was the change?
We got a note saying code 3, so upgraded to lights and sirens, emergent response to the scene.
Okay. And at that point in time, did you have any more information about what the code 3 was?
No, not at that point.
So did you proceed as if while you were en route, did you then upgrade in terms of your response to a code 3?
Yes.
Meaning, did you turn on the lights and sirens?
Yep.
Okay. And ultimately, did you arrive at that location, the 38th and Chicago location?
We did.
What did you see when you arrived on scene?
As we were pulling up to the scene, I saw multiple officers on the side of the road with our patient lying on the ground next to a squad car.
So, as you were pulling up, was that the position that you observed them in, meaning the officers on top of the patient next to the squad car?
Yes.
Could you tell at that point, as you were approaching, what the situation was, or what the condition of the patient was at that moment?
No, there were multiple officers on top of the patient when we pulled up at that point. We assumed, I assumed that there was potentially some struggle still because they were still on top of him. So
Okay.
that was my assumption when we pulled up.
So when you got to the scene, having no additional information, seeing what you saw, that's what was going through your mind, is that right?
Yeah, yes.
So when you got to the scene, what did you do next?
Parked the ambulance near the patient and got out. I walked to the back of the ambulance and my partner walked over to check on the patient.
And what did you see when you got out of the ambulance in terms of the patient's condition at that point?
I was standing a little ways away, so I couldn't get my partner would have a more accurate description of his condition at that point, but from what I could see where I was at, I didn't see any breathing or movement or anything like that.
Did he appear to be unresponsive to you at that point in time?
From what I could tell, just standing from a distance, yes.
And was he in handcuffs?
Yes.
And we're describing the patient here. Was that patient later identified as George Floyd?
Yes.
So when you got out, your partner first approached, is that right? What were you doing at that initial point in time when you first got there?
As he went over to check on the patient, I was watching him to kind of get a cue on what we were going to do next, because we're still determining what the patient's condition was. So I was kind of waiting for him to go check on the patient and then know what to do next.
And at that point in time, when you were standing outside and your partner was approaching the patient, did you see a struggle of any kind going on, any movement, anything like that?
No.
Okay. So after your partner first approached, did you see what he was doing?
Yeah, he checked a pulse on his neck, carotid pulse, and also looked like he checked the patient's pupils.
And did you discuss with your partner at that point next steps?
Yeah, he walked back towards me and I asked, is he in cardiac arrest? And he said, I think so.
So, you use the word cardiac arrest. What does that mean?
It's the term we're going to use for anybody that's not responsive, not breathing, and doesn't have a pulse currently.
Okay. So, essentially, does that mean that someone's heart is stopped?
Yeah.
Are there multiple things that can cause someone's heart to stop?
Absolutely, yes.
Okay. So when you say cardiac arrest, you're dealing with a patient whose heart is stopped. Is that an emergency?
Yes.
Okay. So what did you guys, knowing that you had an individual, George Floyd, in cardiac arrest, what did you decide to do?
So my partner said, let's just get him in the truck. So I unloaded our stretcher to bring to the patient to place him in the ambulance.
And what was the reason for getting him into the truck?
Yeah. All of our equipment at that point was in the truck for resuscitating the patient. And we also didn't have Minneapolis Fire there yet, which they work with us on critical patients like that and help us a lot. So kind of for resource management, we needed to get in the truck. And then on top of that, there was also a crowd of people that appeared very upset on the sidewalk, and I think there was some yelling and stuff, and we, in my mind at least, we also want to get away from that, because running a cardiac arrest, it takes a lot of mental power and focus, and You know, it can be taxing on our ability, so we want to do that in the optimum environment we can. And since the ambulance is right there, we want to be in that controlled space to start resuscitation.
And was part of your reason to move, as you described, to give the best care you could so that you could be focused and away from whatever distractions were happening outside?
Yeah.
And you described hearing people, you know, yelling or loud voices, but was there a physical fight or anything like that happening while you were there?
Not that I saw, no.
Okay. But you decided it would be best for the patient to move to a controlled setting and do your work on the ambulance, is that right?
Yeah, and all of our equipment was there, yeah.
And when you also mentioned fire, tell me why it's important to have fire assist in a situation like this.
There's just a lot of different skills we're going to be doing on a patient to try to resuscitate them, and we work closely with Minneapolis Fire. They're all EMTs, and they work with us on resuscitating a patient, doing things like breathing for them with like a BVM to help the patient breathe, or do chest compressions, and stuff like that.
Okay, so I'm going to break down some of the things you said. You used the term BVM.
Sorry, yeah, it's a thing you squeeze to breathe for your patient, essentially.
To assist with well, if someone's not breathing, is that a part of the process to try to resuscitate
Yes.
the respiration?
Yes.
All right, and we're using the word fire. I assume we're talking about the Minneapolis Fire Department, is that
Yes.
right? And in a lot of people's minds, the fire department fights fires, but you're describing they're also EMTs.
Yeah.
So is it typical for them to assist you with a patient who's in extreme distress or a cardiac arrest or something like that?
Yes, it is.
And you said that there's a lot of work to do. Maybe you could just explain a little bit for the jury why it takes so many people. You know, what's the process that you typically go through when you're trying to resuscitate a patient in that state?
We were doing things like chest compressions to hopefully circulate blood through their body, and you also need to control their airway, so there's some sort of airway has to be placed, and we have to breathe for them. We need to gain vascular access to like an IV or something, so we can give medications to try to resuscitate them, as well as our cardiac monitor, which is going to be monitoring a couple different things, but mainly their heart rhythm.
And to do all of those things at the same time, I assume you would need more than one person at least.
Yeah, it's just the more help you have, you can get it done quicker, and kind of running, you know, once you have everything established, it can run much smoother, but that initial part is helpful, having resources.
Okay. All right. I'm going to just back you up to when you got onto the scene and sort of that first initial interaction you had. I'm going to play a clip from what's already been admitted as Exhibit 47, and we're just going to play a clip from 20:27:35 to 20:29:45. If we could do that now.
Response right now, or you guys might wanna.
Right now.
Are you serious?
You get in the car? Get in the car just for crowd.
Let's get them on this.
You're a baby, bro. So, you gonna let him kick that like that? You gonna let him put that man in front of you, bro? Huh?
Like what?
Bro, he's not even fucking moving right now, bro. He's not even fucking moving, bro. You gonna just sit there with your knee on his neck, bro? You a real man for that, bro. He ain't handcuffed, bro. You a real man.
Need this?
Let's go to 40.
You want one of us to ride with?
Yeah.
Ride with?
Yeah.
Okay. I don't have my phone, so I'll be Baker. What's that?
Help get belted down.
Yep. Where are we going?
We're just going to be down the street.
Okay.
All right, so we can take that down. So just to kind of walk through that clip, the beginning of that clip, there was an individual with a hat bending down over the head of Mr. Floyd. Was that you or your partner?
That would have been my partner.
And what's your partner's name?
Garrett
And what's his last name?
Smith.
And when you initially, at the beginning of that clip, when Mr. Smith was bending down over Mr. Floyd, was that the point in time when he was checking for a pulse and pupils that you described?
Yes.
And you may have been out of the frame for that, but what were you doing while that was going on?
I was at the back of the ambulance. Yeah, I was standing near the back of the ambulance.
And while your partner was checking for a pulse and checking pupils, were the officers still on top of George Floyd while that process was going on?
Yeah.
I'm just going to show you a different clip with a different view of within that time frame. We're going to publish what's already been admitted as Exhibit 15, but just a short clip from that, which will be from 6:45:28 to 8:10:29. If we could publish that, please.
Bro, he's not even fucking moving. Get off of his fucking neck, bro. Get off of his neck. Yes, look at that, bro.
Back on the street.
Are you serious? Bro, are you serious? And you gonna keep your thing on your neck? Yeah, I bet you. Bro, bro, I barely touch me like that, dude. I swear I'll slap the fuck out of both of y'all.
I didn't want to call the ambulance.
Bro, you just gonna let him keep his hand on his neck, bro? You're a bitch, bro. Tao, you gonna let him keep that like that? You gonna let him kill that man in front of you, bro? Huh?
Like what?
Bro, he's not even fucking moving right now, bro. He's not even fucking moving.
This is what it is. We gotta deal with this.
Bro,
They're not gonna help us, bro.
Right. He black. They don't care.
97 years
If it
old,
ain't they
bro.
people, they don't care, bro.
You gonna just sit there with your knee on his neck, bro. You a real man for that, bro. He ain't handcuffed,
Look at him.
bro.
Just
You a real man, bro. You a real man, bro. I train with these dumbass
bro.
niggas,
The fact that you guys aren't checking his pulse and doing compressions if he needs that, you guys are on
Oh
another
my
level.
God, bro.
And then he just gonna throw him
They
up
just
there like
dragging
that.
him like, come
Yeah,
on
and
now.
I have your name tag, bitch.
That's not very professional.
It don't matter. So what? Freedom of speech. Freedom of speech, bro.
We can take that down. So at the end of that clip, there's another individual without a hat toward the head of Mr. Floyd. Was that you in that position at the end?
Yes.
And you were seen bending down over Mr. Floyd, and there was a gesture made with your hand. What were you attempting to do at that point in time?
Just have the officer move.
And again, did you have a conversation at that point, or what was the intent behind that?
I don't recall if I said anything or not. I'm not sure.
And why did you need the officer to move?
So we could move the patient.
And then were you continuing to assist on the head side of Mr. Floyd while the patient, Mr. Floyd, was moved?
Yes.
I believe there was a clip in there where you were holding or had your hands near his head. What were you trying to do there?
I was just trying to keep it from slamming down on the pavement as we moved him over.
And how would you describe sort of the way that Mr. Floyd was moved to the stretcher?
What do you mean by that?
That wasn't a very good question. Well, you were trying to keep his head from slamming into the pavement. Why is that?
Because he was, I guess limp would be the best description. He wasn't, he was unresponsive and wasn't holding his head up or anything like that.
And were you trying to protect his head?
Yeah.
At that point, okay. All right, so what happened next? We saw the initial clip where Mr. Floyd was loaded up onto the ambulance. Did an officer come with you?
Yes.
And what was the purpose of that?
To do chest compressions for us.
And was part of that the reason you described in terms of having, you need more people to work on a patient in this case, in this situation?
Yes.
So what did you do at that point in time?
I think you can see it in the video. My partner and I had a brief discussion that we were going to move a couple blocks away.
And was that the reasons you described earlier?
Yes.
Did you ultimately go to another location?
Yeah, I went to the front and drove the ambulance and went to 36th and Park.
Okay, and I am going to show just you, not the jury, an exhibit that has not yet been admitted, but if we could just put exhibit 73 on the screen, please. All right, so you should see in front of you a map. Does that appear in front of you?
Yes.
And does that show a map of the area where you were on May 25th, 2020?
Yes.
And does it show both Cup Foods and sort of where the ambulance ultimately parked for a period of time to render assistance?
Yes.
Your Honor, I'd offer Exhibit 73.
No objection, Your Honor.
73 is received.
And we'd ask permission to publish that to the jury. All right, so now that's up on the screen. If you could just describe where you went and how you got there.
Also status, if you want to draw on the screen.
We would have gone down 38th and then up Park here.
And if you could just describe, you had talked about the reason to move, but why did you need to stop?
Like I said, it's resource intensive or doing a resuscitation, so I needed to be in back to work with my partner in resuscitating Mr. Floyd.
And at that point, it was just the two of you plus this officer, is that right?
Yes.
And did your partner need your assistance to perform those resuscitative efforts?
Yes.
So what, did you ultimately park and then go back to assist in the back of the ambulance?
I did.
And what was going on when you got back there?
I can't remember everything that was going on at that exact moment when I walked into the ambulance, but
let's start with this. I mean, had his condition, had Mr. Floyd's condition improved? Had he gotten better?
no. I remember walking in and the cardiac monitor was showing asystole. So
Okay, so I'm going to stop you there because that's a word that not a lot of people know. What is asystole?
it flatline, so it's monitoring your cardiac electrical activity. I guess like flatline is the most layperson friendly term, but basically tells us your heart isn't really doing anything at that moment.
So there's essentially no activity in the heart.
Yes.
So when you came back and saw that the monitor showed asystole, well, what's the significance of that just in terms of a patient's condition?
It's not a good sign for a successful resuscitation. But.
And is that, can you explain why? Why is that?
Basically just because your heart isn't doing anything at that moment. There's not, it's not pumping blood, so it's it's not a good sign for a good outcome.
So what did you do noticing that he was in asystole, and obviously your partner had been working on him while you were driving as well, is that right?
Yes.
So how did you join in those efforts?
A couple different things. Worked on getting him placed on a Lucas device, which does chest compressions.
Okay, can we just stop for a sec so you can explain what the Lucas device is and how it works?
Yeah, it's a device you place over their chest that has a plunger that does compressions for us to do chest compressions to circulate blood.
And I'm going to put on the screen what's already been admitted as Exhibit 62. All right. So Exhibit 62 is on the screen. Can you just describe what's shown here and what you're doing?
There's a backboard that goes behind the patient, and it has to like click in and connect to it in order to work. So I was hooking it up.
And is that part of the Lucas device?
Yes.
So when you say backboard, maybe you could use your stylus or your finger to just sort of circle or point to what you're talking about.
That little yellow, it's a piece there, it's a board that goes all the way across their back.
Okay. And to set it up, it has to be positioned in a certain way, is that right?
Yes.
Okay. So you were assisting with getting that set up, and is the other hands here the other officer who was on the ambulance with you at that time?
Yes.
And then the other person behind you, is that your partner, Mr. Smith?
Yes.
Okay, and we'll move to Exhibit 63, which has already been admitted. Okay, so once you get the Lucas device going, I mean, just describe what does it do? How does it assist you in this process? In providing compressions, that sort of thing.
Yeah. How does it assist us? I'm not sure what you mean.
Well, is it done sort of as a way to replace or make it so that hand CPR, that, you know, the compressions that people might think of when they think of CPR, does it sort of do that for you instead?
Yeah, it does that for us instead, yes.
And can you just sort of describe how that works? Maybe not the mechanics of the machine, but just what you see happening when you see somebody on a Lucas device.
That center plunger right on his chest, that moves up and down and does the compressions.
Okay. So does it also free up your hands to do other things while there are compressions being given by the machine?
Yes.
Okay, so after the Lucas device is set up, and before we actually move on, I mean, did you notice injuries on Mr. Floyd as well while you were working on him?
I wasn't really like examining him at the time for injuries, but I noticed some blood near his mouth.
Okay. But were those your primary concern at that point?
No.
And why is that?
It'd be just on glance, it looked like a minor injury, and it's not really a concern because we're worried about resuscitating him.
Because at that point he didn't have a heartbeat, right?
Yes.
Okay. So now in this picture in 63, which one of these individuals are you? Is you?
I'm the one near the patient's head.
Okay, so what are you doing there?
Placing an iGel airway device.
And what is an iGel airway device, and what does it do?
I place that in their mouth. It goes near the glottic opening to their trachea. Means you can use that BVM, that bag I was talking about, to breathe for them and ventilate them.
And why is that important to what you're doing?
It's a part of securing their airway to make sure liquid or fluid or vomit or anything doesn't end up in their lungs, and also helps us deliver oxygen and ventilate effectively.
And at this point, I assume that you're doing this because he's not breathing.
Yes.
Okay. meaning no respirations are happening for him, so you're trying to use your equipment to do that. Is that right?
Yes.
Okay. So did you ultimately, well, let's move to Exhibit 64, which has already been admitted. Yes. So were you ultimately able to place that airway?
Yes.
And is this, in Exhibit 64, is that part of the process that you're working on with respect to Mr. Floyd's head and face, mouth area?
Mm-hmm. Yes.
And your partner, what's he doing at that point in time?
He is working on getting IV access.
And you talked a little bit about IV access before, but what was the purpose of getting IV access in this, for his treatment, for Mr. Floyd's treatment?
To administer medications.
And what were the medications that were administered to Mr. Floyd?
All of them that we would have given.
Well, I don't know if it's a long list, but what was the primary purpose? What were you trying to give him?
Yeah, epinephrine is like a first line medication when somebody's in cardiac arrest.
Okay, so did you give him epinephrine?
Yes.
And why is that when you say it's a first line for cardiac arrest? What does it do?
Helps to restart their heart.
Okay. All right, so getting back to the treatment, we were talking about epinephrine and why you give that. You said that's something. Can you repeat what you said, just so I can recall?
It's at that point, it's something we're going to give to hopefully help their heart start working again.
And is that one of the things that you do, sort of standard practice with a cardiac arrest?
Yes.
And do you also give sodium bicarbonate as one of your treatment options for a cardiac arrest as well?
Yes.
And is that does that provide assistance if there's been downtime or some extended period of time without a pulse? I can rephrase.
Why don't we rephrase?
Why do you give sodium bicarbonate?
Based on my training that I was given, it's to help with acidosis.
And what is acidosis?
Essentially, your pH would be low. There's many different things that could be causing that, but
Well, why is it bad to have low pH?
I won't dive into the details on it because I'm not an expert, but based on my training, it needs to be, acidosis is bad and we need to work on correcting that.
And is acidosis something that can be caused by things like hypoxia?
Sustained.
All right, so when you're talking about acidosis, what are you trying to treat in the moment? What are you dealing with?
I'm giving sodium bicarb to help to optimize the patient's condition for successful resuscitation.
And in terms of your work as a paramedic, when you come upon somebody whose heart has stopped or who's in cardiac arrest, is giving medications like epinephrine and sodium bicarbonate part of that sort of standard treatment plan for you?
Yes.
Okay. I believe we just took down Exhibit 64. We're going to just put up Exhibit 65. Okay. Maybe if we could just go back to 64 just for a second, because I'm not quite sure which exhibit I had on there. All right, I believe we had 64 up. Let's move to 65. Okay, and again, could you just describe what you're doing at this moment in Exhibit 65?
At that moment, I am working on securing the iGel airway device. In my right hand there, that blue thing is a tube holder, we call it, to put in the patient's mouth to keep the airway device in place.
Okay. And while you're working on the airway, is your partner working on the IV?
Yes.
And was that for purposes of administering the medications we just discussed?
Yes.
Okay. We can take that down. Thank you. At some point, did the Minneapolis Fire Department arrive to your location to assist?
Yes.
And what was Mr. Floyd's condition at that point in time when they arrived?
We're the same. Yeah.
It hadn't improved, is that right?
No.
Okay. What did you do when the fire, well, how many firefighters came?
I don't know that I can remember for sure how many were in the back. I believe it was 2, but I'm not 100% sure.
And did your role change at that point when the firefighters arrived?
Yeah.
What did you do at that point?
I believe at that point I started working on working on IV access.
And was there sort of a switch of jobs when the firefighters came in?
Yeah, at some point the officer stepped out and I kind of moved down to near where he was sitting.
Okay. So when the firefighters came, did you feel like there were enough people to do what you needed to do for Mr. Floyd in order to get him where he needed to go?
Yeah.
So you said the officer stepped off. Did one of the firefighters take over with respect to what you were working on in the airway?
Yeah, the airway was established, so they're working on squeezing that bag to breathe for the patient.
And maybe you could just describe how that works. Does someone need to squeeze the bag in order to provide, well, how does it work?
Yeah, it's just a bag that you're going to squeeze roughly every 5 to 6 seconds to breathe for the patient.
And so after you had set it up and the firefighters arrived, did one of them take over that part?
From what I remember, yes.
And then you said you moved down and assisted with the IV. Can you just describe that?
I just worked on trying to get IV access.
And was there some difficulty with that?
A little bit, I believe. I believe we had IO access at some point, but I don't know when that was done.
And what is IO access?
It's a needle that drills into your bone in your leg. It's another way of giving medications.
And why would you need to have that kind of access?
You're having difficulty with IV access, and it's common to do in a cardiac arrest.
And IO stands for?
Intraosseous.
Intraosseous. And IV is?
Intravascular.
Okay. So at some point, did that get established, an IO line?
Yeah.
And was that the way that the medications were administered?
I would need to look at the documentation to be for sure on that, but I believe that's how they were administered.
But in any event, do you recall that he was administered those medications?
Yes.
What did you do after that?
We continued working on resuscitating for a period of time, and then I kind of had everything done we wanted to, and then I went to the front and started driving to the hospital.
Maybe you could just explain, was there something that you needed to accomplish before you felt comfortable moving again, driving the vehicle elsewhere.
Yeah, I think there's a standard set of, we call it like ACLS guidelines from the American Heart Association. It's how we're trained and how we do provide care in a resuscitation like this. We kind of had all those things in place.
So what are those things? Just generally, what are you trying to do?
Yeah, just to highlight, I'll say chest compressions, breathing for them, and doing medications that we need to give them.
And is it your objective to have those things in place before you transport to the hospital?
Yeah, it's time sensitive to have them done, so we need to get them done right away.
And maybe you could explain what's time sensitive about these resuscitative processes?
Just the longer the patient goes without receiving resuscitation, the lower likelihood they will be resuscitated.
And in your training as a paramedic, when you're talking about time sensitivity, when it comes to resuscitative efforts or things like CPR or anything like that, what are you trained to do in terms of timing?
Can you rephrase the correct question?
Yeah, that was not a good question. Is it important to start resuscitative efforts immediately after someone does not find a pulse?
As soon as we can, yes.
Okay. And why is that?
Primary goal, I would say, is circulating blood through chest compressions. Yeah.
And I think you previously testified, if there's a delay, does that lessen your likelihood of success?
Rephrase.
What happens if there's a delay?
Based on my understanding, that's not good for his outcome.
Okay. So ultimately, after you had the things in place that you just described, did you then transport Mr. Floyd to the hospital?
Yes.
And were you the driver?
Yes.
I'm going to put on the screen just for you an exhibit that has not yet been admitted as Exhibit 67. Can you see that?
Yes.
And does this image fairly and accurately show you and your partner and the firefighters unloading Mr. Floyd at the hospital?
Yes.
Your Honor, I'd offer Exhibit 67.
Any objection? 67 is received.
Permission, thank you. And once you got to the hospital, did you assist in moving Mr. Floyd, transferring him inside to the hospital with the others?
Yes.
And we can take that down, thank you. And what happened at that point in time, once you were bringing him to the hospital?
There's a room we call the stay room for critical patients. We bring him into the ER. Brought him in there and moved him over to the hospital bed.
And what was his condition? You had talked about asystole at the beginning of your interaction with him. Once you had worked on him and then brought him to the hospital, what was his condition at that point in time?
I don't know what his exact cardiac rhythm was at that point, but his overall condition did not appear to change.
And had you noted any changes? Was there a period of time of pulseless electrical activity?
At some point, yes.
And would that have been at some point after the asystole?
Yeah, I can't tell you exactly what point it was, but...
Sure. So just so we know what we're talking about here, what is pulseless electrical activity?
It's essentially it's picking up an organized rhythm, so electricity over your heart, but we don't feel a pulse anywhere. So it's, on our purposes, it's not perfusing, so we'd continue chest compressions.
Okay, so you said not perfusing. What does that mean?
Yeah, so we don't feel a pulse, so there's no blood being pumped through the body to your organs.
And if you, well, as someone is being worked on or compressions are being given, can things change in terms of the heart rhythm in your experience as a paramedic?
Yes.
But if you have pulseless electrical activity, what does that mean in terms of the change?
It's as far as how we're going to be resuscitating him, it's the same as asystole. So
your course of action
yeah,
remain the same.
yeah, they're asystole and PEA is like the same protocol, I guess you'd call it, for how we resuscitate.
And even though there was, when he first arrived, he was in asystole. At some point later, there was PEA. At any point, did he regenerate a pulse or come to? Was he revived?
No.
And ultimately, at the hospital, was there a report given to staff at the hospital about his condition and all of those things that you did?
Yes, my partner would have given that report to the hospital.
And were you assisting with the other needs as well? Were you part of that process?
Yeah.
And what did you do after the patient Mr. Floyd was handed off to medical staff at the hospital?
I would have just been bringing equipment back to our truck and putting it back together.
Again, over the course of your interaction with him and treatment of Mr. Floyd, did you notice any positive change, any revival?
No.
Nothing further.
Mr. Nelson.
Good afternoon, sir.
Hello.
Yep, we're afternoon. Sorry, I had to check the time.
Yeah.
Thank you for being here. Just have a few follow-up questions for you. I want to just understand sort of the very briefly the progression of your education and kind of the differences. Is CPR training then different than being an EMT?
You're talking about like a CPR certification?
Yes.
Yes. It's a part of it, but yeah, it's different.
So the basic kind of resuscitative training someone could receive would be a CPR certification?
Yes.
And then kind of a higher level of education would be an EMT, right?
Yeah.
And then a higher level than an EMT is a paramedic?
Yes.
And then up through, all the way up to doctors and stuff, right?
Sure.
Okay. And you are a paramedic, you said you've been about 4 years now?
With Hennepin EMS, I was a paramedic elsewhere prior.
Okay. How many years total as a paramedic?
I started as a paramedic in 2013.
Okay. And so in Hennepin, for Hennepin County, do you frequently service calls in the city of Minneapolis?
Yes.
Do you frequently call or service calls where police officers are involved?
Yes.
Do you have you arrived at a scene where you've seen officers on top of a person before?
Yes.
Have you been called to other calls where a suspect has struggled with the police?
Yes.
What does it mean to stage as an EMS?
What does it mean to stage?
Mm-hmm.
If you're referring to like staging for safety purposes?
Correct.
Yeah, if if a scene is not safe, we will stage in the area and wait for police to give us what's a code 4, we call it, that it's safe to come in.
And just for clarification purposes, you were not asked to stage in this event, right? Because of the crowd?
No, we were not.
All right. But generally speaking, it's common for police to arrive at a scene, deal with whatever the circumstances are, and then EMS is called in after police has dealt with the danger of the situation, right?
Can you say that question again?
Sure. It's kind of long-winded. Police will frequently go to a call before EMS to deal with some dangerous situation.
Yeah, it completely depends on the type of call.
Right. As a course of being a paramedic, have you responded to other overdose calls or overdose calls?
I have responded to overdose calls, yes.
And is it Hennepin EMS policy to have police respond to those calls with you?
Yes, they do usually. I can't reference a policy, but
okay.
In my practice, or my experience, they do respond with us.
And is that because when people are sometimes resuscitated or treated for an overdose, they become aggressive and violent?
Objection, Your Honor.
Overruled, if you know.
Sorry, can you say that again?
Sure. Is it the practice to have police respond to those calls because when people are resuscitated or revived from an overdose, they can become violent or aggressive?
It can happen sometimes, yes.
Have you personally seen that happen?
Yes.
So turning your attention to May 25th of 2020, you were the driver of the ambulance that day, correct? Or for this call, I should say.
For that call, yes.
And after all of this, you would agree that you have met with law enforcement officers during the course of the investigation of this case?
Yes.
And you have made statements, and you know those statements were recorded?
Yes.
And do you know that, have you had an opportunity to review a transcript of your statement prior to today's testimony?
Yes.
Okay. You've also met with the prosecution team a couple of times, is that correct?
Yes.
In preparation, including as late as last night, correct?
Yes.
And you kind of just talked about what your testimony was going to be today, right?
Yes.
All right. So on May 25th, when you arrived, you testified that you saw sort of a crowd standing out around the police officers, correct?
Yes.
And when you arrived, the ambulance actually pulled ahead of where Mr. Floyd and the officers were located, correct?
Yes.
And that would be for ease of loading him into the ambulance, correct?
Yes.
So that basically the back of the ambulance would be in line with Mr. Floyd's and Mr. Floyd to kind of get him into the ambulance, right?
Yes.
All right. And so when you got out of the ambulance and you walked back towards the office, you would have had to walk back towards the officers, correct?
Yeah, I can't. Yeah, yes. I don't know which side of the ambulance I walked back on, but yes.
Well, if you're the driver, you would have gotten out of the driver's side and walked along the driver's side of the car.
Doesn't necessarily mean I walked down that side, back to the back of the ambulance, but
okay. You may have gone around the front.
I may have gone around. Yeah. Okay.
Do you recall describing to agents the position that you saw Mr. Floyd in at that time?
I can't. Yes, I remember talking about it.
You remember talking about it?
Yes.
And what did you tell the agents about how you observed Mr. Floyd's body position to be?
I can't remember exact details. I remember he was on the ground and he had handcuffs in place.
Okay. Do you remember saying that he was primarily on his left side?
I think I did say that, yes.
Okay. And is that what you recall today?
He wasn't. I don't remember if I clarified that at all. Like, to me, it seemed like he was leaned to his left. Is kind of I think what I tried to say.
So he was kind of leaned to his left, and I think you said, and he was sort of rolled forward onto his stomach a little bit.
Yes.
Would you dispute me if I say that's what the transcript refers to?
No.
Okay. All right. And so you and your partner decided to do what's called a load and go, right?
To get into the ambulance, yes.
Right. And to leave.
To move, we didn't leave. We moved to a different location, yes.
Right. And that was out of concern because of the people that were around, right? And the general atmosphere at the scene at that point.
Yes. That was a part of it, yes.
In terms, I forgot to ask you one question, generally speaking, in terms of your response to calls where police are struggling with an individual, does Hennepin EMS carry ketamine with them?
Yes.
And what is the purpose of the ketamine?
It has multiple purposes.
Is one of them to sedate someone if they are struggling?
It is able to use for that, yes.
Obviously that you didn't apply ketamine in this case.
No.
So you loaded Mr. Floyd into the ambulance, correct?
Yes.
And one of the 4 Minneapolis police officers that you observed at that scene got into the ambulance with you, correct?
Yes.
It was one of the same officers that you observed on Mr. Floyd at the time, correct?
I wasn't keeping track of who was who at that point. I believe he was near Mr. Floyd.
So the photos that we looked at, right?
Yeah.
Those came from what appeared to be a body-worn camera, correct?
Yes.
There's no camera in the care compartment of an Hennepin County EMS ambulance, is there?
No.
And you do not wear body cameras as paramedics, correct?
No.
So those photographs came from an officer's body-worn camera.
Yes.
And so that officer initially started assisting with chest compressions of Mr. Floyd?
Yes. I wasn't in back when that would have happened, but
Your partner was?
yes.
And he would probably be the person to ask about that?
Yeah, I would have been. You can see in the footage we watched, but I was there for a brief period and then went to the front to move.
All right. So you've seen the body-worn camera footage from inside of the ambulance?
I've seen a good amount of it. I don't know if I've seen all of it, but
Okay.
I've seen a good amount of it.
You described the Lucas device you described that Lucas device that does the chest compressions, right?
Yes.
It was your partner that was putting that on with that police officer, correct?
No, I was putting that on with the police officer.
Okay. So you were in the ambulance when the officer was performing chest compressions?
Yes, after I pulled over on 36th and Park and got in the back, he would have been doing chest compressions.
So the first thing you did was load Mr. Floyd in to the vehicle. You drive to 36th and Park, right?
Yes.
And while you drove that distance to 36th and Park, the officer was in the back with your partner performing chest compressions?
I would assume I wasn't in back.
Right. And then, but when you got into the back to assist your partner, that's what you observed was the officer performing chest compressions?
What I remember, that he was doing them at that time, yeah.
And then you and he actually attached the Lucas device to Mr. Floyd?
Yes.
And it was a little difficult to get on?
Yes.
There was a latch problem or something?
Yes.
And then at some point you testified that you did, I think you called it an iGel aerate device?
Airway.
Airway
Airway
device, I'm sorry. You inserted that into Mr. Floyd's mouth, right?
Yes.
Now, does that actually go down into the throat? Is it like a tube that goes through the throat?
Partially, yeah.
Okay. Any difficulty getting that in?
No, there wasn't difficulty getting it. You went in fine. The first one I grabbed was too small.
So there are different sizes?
Yeah, there's different sizes. So I had to, initially I put that one in, and then had to pull it out and put a larger one in.
So there was nothing constricting or obstructing your ability to insert that device into his mouth and throat?
No.
And the medications that you described, the sodium bicarb and the epinephrine, were applied, and some other medications as well?
Yeah, I'd have to look at the report to know exactly what meds were given, but yes, those meds were given.
Right. And once you kind of got those initial 3 things you described done, at some point fire came out as well, right?
Correct.
And let me ask you one question that I forgot to ask you about the initial call. The initial call you said was code 2, correct? And it got upgraded to code 3, meaning lights and sirens.
Correct.
And that was about a minute and a half after the initial call, agreed?
Based on what I looked at the times, from what I've seen after, it looked like it was about a minute and a half.
Okay.
Yeah.
And the time from when it got upgraded until you arrived on scene, would you agree that was about 6.5 minutes, something like that?
I believe it was close to that, yes.
Okay. And then it was was it you who added fire to the call, or was it your partner?
I believe, I can't say for sure who said it first. I believe my partner said it first over the radio.
Okay.
Yes.
And that's when fire gets dispatched, and they ultimately, you understand, went to Cup Foods first?
I heard that afterwards, yes.
Okay. You didn't know it at the time?
No, when as we were moving to 36th and Park, I went over the radio and told our dispatch that we were going to be moving to have fire meet us there.
Okay. And then the information you had as you were initially responding was that there was a mouth injury, correct?
Yes.
And that there was information that the male may be intoxicated or impaired?
Yeah, there were some notes about, I can't remember the exact wording, but there's something about substance use, or I can't remember if it said narcotic or substance use concern, and then there was a note saying he was on top of a vehicle.
Okay, so you remember seeing that in the computer-aided dispatch?
Yeah, I saw that on the way to the call. Or sorry, that would have been my partner that would have seen that.
Okay. And then there was also some information that police had Mr. Floyd restrained on the ground, right?
In our CAD notes.
Okay.
I'm
you were
not
driving.
Yeah, I'm not sure. There was a note that popped up right as we were arriving, so I'm not sure if you're referring to that, but I don't recall if it said he was restrained or not.
Okay. Fair enough. I have no further questions.
Selvage.
Mr. Bravinder, you were asked some questions about responding to scenes where someone might be violent or struggling, things of that nature. Do you remember those questions?
Yes.
And when you got to the scene, was Mr. Floyd struggling or violent in any way?
No.
Did it appear to you that he was already dead when you got there?
No.
I wouldn't know when I pulled up on scene, but I did not see him, as I testified earlier. When I was standing at the back of the ambulance, I didn't see him moving or breathing.
Right. So from what you saw, did you see someone who appeared to be unresponsive?
Yes.
And in cardiac arrest?
As we learned, yes.
And you were asked some questions about ketamine, things of that nature. Is ketamine a drug that's given to people that are alive and struggling?
Sometimes, yes.
And is that a treatment option for you for somebody who is exhibiting those behaviors that you were asked about? Violence and struggling, that sort of thing. Alive and moving, basically. Is that right?
Yeah, it's for profound agitation, so somebody that's really violent
You would not give that to somebody who is dead or in cardiac arrest or unresponsive, is that right?
Correct, we would not give it, no.
And you're asked about responding to overdoses as part of your job. When you respond to overdose deaths or an opioid overdose death, what do you look for in terms of someone's pupils?
We look at them to see if they're small. Their pupils are really small.
When you say small, is that like pinpoint, constricted?
Constricted, pinpoint, yes.
And do you know what Mr. Floyd's pupils looked like when you and your partner arrived on scene?
I don't recall looking at them myself. I know like I said, my partner checked them initially.
And did you receive a report about that from him?
Yeah, he did say something. I'd be kind of guessing. I believe, I think I know what he said, but.
All right, we'll move on from that. Okay. You were asked some questions about the crowd and whether that was the reason to move Mr. Floyd to another location. Remember those questions on cross-examination?
Yes.
You testified on direct examination that there are a number of things that you consider when you determine whether to move someone. Is that right?
Yes.
So is having a crowd one of those things that you might consider?
It's one thing to consider, yes.
But you also talked about how you needed a significant amount of equipment that was in your ambulance. Is that right?
Rephrase.
What are the other things that you consider in terms of why to move somebody to another location?
Overruled.
You can answer.
Sorry, can you ask that last part just one more time?
What are the things that you take into account when deciding whether to move a patient to another location?
Yeah, so in that case, moving into the ambulance was equipment was a consideration of that, and being in a good environment to resuscitate.
And do you also, I believe you may have testified about this, but does it require focus on your part?
Yes.
And are all of those things part of your consideration on a scene about what to do?
Yes.
If I may have just a moment. Nothing further, Your Honor.
Mr. Nelson?
Mr. Bravinder, have you, in your experience, ever responded to a scene of someone under the influence of methamphetamines?
Yes.
Do methamphetamines cause that same restriction in the eyeballs?
My understanding, no.
And in fact dilates them, correct?
Yes.
Nothing further.
Thank you. You may step down.
Thanks.